Well, so thank you very much for being here. I know it's hard to give up a Saturday to come and hang out with me, so I want it to be valuable for you. And I've tried to make today a lot more interactive and a lot less lecture so that you leave here with actual strategies that are going to work in your classroom. And it's going to be an opportunity for us to have some dialogue about what you need and what will work and what won't work. So as Ms. Vicki said, I'm a licensed clinical social worker. My clients are children and families who've been traumatized, abused, and neglected. So they've been through all sorts of terrible things, and my job is to help them function in a really healthy way, contribute to society in a healthy way. Part of what I bring to the table is I have a background in education, and so I went through the whole bachelor's degree in education, did student teaching, all that good stuff, knew I didn't want to be a teacher, but knew I needed to have that understanding because kids spend a lot of time there. Did school-based mental health for a long time, and I recognized that many of the educators that I was working with did not have some of the same knowledge that I was getting as I was going through my master's around trauma and mental illness. And so I'm excited about this opportunity. I'm really glad that Montana is really embracing some new ideas around trauma-informed education, because I think it's an opportunity to really help our kids in their brain development. So we're going to start with an activity today. I want you to get out a piece of paper. If you don't have a piece of paper, I have a piece of paper you can borrow. You can have. I want you to make 2 columns. They don't have to be very big columns. You're only going to write 5 things in each column. So in the first column, I want you to write down the names, the actual names of 5 people you love and adore. Hopefully you have 5 people you love and adore. You could include your pets if you need to. Right? Celebrate pets. Sometimes we feel more loving towards our pets than people, right? They don't talk back. In the second column, I want you to write 5 things that you love and adore. Worldly possessions. Things. It's okay. I mean, maybe you had a different idea around 5 things. It's a fluid concept. Maybe you have a favorite pair of shoes, favorite stuffed animal. Maybe you like your car. It's okay to be a little superficial. All right, now I want you to share your list with your neighbor. I'm a sharer person, so if you don't have a neighbor, find a neighbor. You're gonna be sharing a lot. Okay, now I want you to take that list and I want you to mark 1 thing off on each side. You have to pick 1 person, cross them off the list. They're no longer in your life. Take 1 possession, cross it off the list. They're no longer, you no longer have it. And then in your third column that you haven't created yet, but you're now going to create, I want you to write how that just felt. How it felt to cross that person and that thing off of your list. Okay, now you have to cross another person off. And another thing. And another feeling. And you can't be mad at me. It's just a process. And now, as you're thinking about the second one you just crossed off and the second thing you just crossed off, I want you to notice in your body where you're feeling what you're feeling. Like your heart might race a little bit, you might have gotten a lump in your throat, you might start getting a headache. Breathe. Everybody needs to breathe. You're like, oh God, what's next? Well, you know what's next, right? Okay, cross number 3. And now I want you to talk in your little groups about the feelings you've just written down. What did it feel like to just cross off 3 people and 3 things? They're wiped out of your life. No longer there. All right. Now I want you to cross one more person off that list and get rid of one more thing. And I want you to write down another feeling if that created another feeling that's different than what you already have. And I want you to sit quietly for a minute and really honor how you're feeling. Where do you feel that? How many of you have like this spot kind of right in your heart that's aching because you just crossed someone you love off your list? Okay? How many of you get a little teary thinking about that? Right? Like at this point in my activity, I'm at my kids and my husband, right? And I'm like, oh my God, what would my life be like without my kids and my husband? Right? Cross the last person off. Last thing gone. Now you're there with your blank piece of paper. Write down your feelings. Unfiltered. You don't have to share this part. What's that like to sit there and think about all the things and the people you just lost? Pretty heavy activity, isn't it? So the reason I started you on that today is because the kids we're talking about have done exactly what you're doing right now. The kids that you were here for today are feeling what you are feeling. I only asked you to list 5 people and 5 things. Think of the loss that the kids have had who we're going to talk about today. It's a lot more than 5, usually. Now, if I'd had another column that said list your home, what you consider home, right? Like it doesn't have to be the structure, but who's your new home? What does your home look like? And then I asked you to X that off. Most of the kids that we are going to talk about today, there's an average of 6 different placements that they've lived in their life. Placements, that's different people, different caregivers. Can you imagine what that's like to be ripped out of connection and placed in complete stranger land, right? So I'm asking you today to dig deep. Like this is day 2, right? We're getting deeper today. I want you to dig deep and I want you to really focus on how these feelings impacted you in the last 10 minutes and think of what that's like when you go through every single day feeling that stuff. Okay? And then we're all going to take a deep breath. Because if we stay heavy like this all day, it's going to be a long day. We're not going to stay heavy like this, okay? But I really want, you guys are here for a certain reason. I don't think anybody gives up their Saturday because they want to give up their Saturday. I think they come because they're motivated, because they want to help the kids in their lives. I truly believe that you're all here for a certain reason. You have somebody in mind. You have some buddies in mind. You're hoping to get something out of today, right? So now, I want you to shift gears a little bit, and I want you to talk to your partner a little bit about what you want to get out of today. Why are you here? Who brought you here? Who's the little guy that's cuter than cute and you need some more strategies with because you're going to string them up by your toenails if you don't? Right? Who's the teenager who's driving you crazy and you know that they're hurting and they're having a hard time and you want to connect? Okay? Go. All right, so let's come back together. So I want to hear a little bit from you guys about what brought you here. Why are you here and what do you want to get out of today? So, anybody got any answers? What brought you here? What are you hoping to get out of today?
So, my partner and I were just talking about how we're both here for the same reason. It's not so much like a specific student. It's more the general staff that we work with and helping them be more cognizant or empathetic. Help them have a greater understanding of some of the innocuous things they think they're saying that aren't so innocuous.
So you ladies are in positions where, now I want to make sure I've got this right. You are not direct educators, you're support people, right? Like, not to minimize that in any way. And I want you to hear that. So occupational therapist and school psych, okay? Two people who teachers turn to when things are falling apart in their classroom and the kids are having a struggle with, right? So you guys are here because you want some more strategies and more ways to support your teachers.
Yeah.
Awesome. Okay, anybody else here for that same reason? Okay, good to know. All right, thank you. Okay, who else wants to share? What are you here for? Okay.
For my daughters.
Daughters.
I'm also a student of the class, but also I have 3 kids with my family. I have mine and my fiance's kids, and we have ADHD and bipolar
Right.
in our family with our kids, so we're here to learn more about how to really help them.
Excellent. So how many of you are parents in this classroom? What you learned today, could you possibly apply to your own children? Dear God, I hope so. Right? And actually, I am a big fan of applying it and seeing how it works out with my own kids and then tweaking it with my others. So, all right, thank you for sharing that. Okay, what other reasons are you here for today?
I work in a school district, and basically I work around these kids who have been placed around at least 2 or 3 group homes different, and so a lot of the staff doesn't really know how to, if yelling doesn't work, they don't know what to do. So we're kind of interested to see different strategies and open their eyes a little bit.
Excellent. Other strategies. Okay, so how many of you grew up in homes where yelling happened? That was the parenting strategy. Okay, so we do what we know. So it comes naturally to us to do what we grew up in, whether we're parents, teachers, whatever role we're in. When we have to manage children, it's natural for us to do what we grew up with, right? So it's always good to have other options, okay? If we grew up in homes where we were yellers and those kind of things. All right, what else? Somebody else raise their hand over here.
Oh, I'm a school counselor in an elementary school here, and it's very high poverty, a lot of trauma
Okay,
with the families and things.
so more strategies, more information about trauma. Okay, we'll say that word trauma a lot today, so you're gonna get a lot of information about that. More strategies. As a school counselor, people turn to you. They want you to have that information, and so you should leave today with a bucket load of stuff. If you don't, you chat me up and say, Stacy, I'm disappointed, okay? All right, any other reasons you all are here today?
Early childhood.
Early childhood, love it. Why is early childhood important?
Just the beginning. Impacts it all.
Right, so what we know is that the brain is 90% organized by age 3 to 5. There's like various, but regardless, before they start school. So 90% of the brain is organized before 5 years old. So early childhood education is imperative that we have people who understand trauma, right? We were chatting this morning, parents get to bring their kids home from the hospital, they don't even have a parenting class. They might not even know what's right, what's wrong. And they might have all the best intentions of the world and not know that what they're doing isn't the right thing to do. Because they're doing what they've known, which may or may not have been healthy, right? Okay, any other reasons people are here today? Did we cover them all? All right, so I always task you that you have to leave with at least 3 things today. That's new information. If you don't have those 3 things, then you gotta let me know before we end. If you don't let me know, that's on you. That's not on me, because I'm gonna give you lots of information. So a couple things. One, you guys do not have copies of my slides with you currently, but I will give you those. I will email them to you. So you will get that. If you don't get them, email me, because it means that I typed it in wrong, or I didn't get it right. So, okay? All right, so we're gonna review a little bit. How many of you were in session 1 or watched the first videos? Okay, how many of you haven't? I should ask that question. That would answer. Okay, well, either way, I believe in repetition, because that's how we learn new things. So we're gonna review a little bit from the first session. So some of you, you've heard all of this, but it's okay to hear it again, right? Because it's new information. So, okay. Before we review, I want to remind you, you all are pioneers. There are not very many people who are interested in trauma-informed education. So when you go back to your schools and you have new strategies and you have teachers who've been doing this for a long time and they're like, that's never going to work. Or I don't want to do that. Remember that you are turning a corner and you are new into doing this. And this is really important, okay? The other thing I want to let you know, if any of you are on a little thing called Facebook, I have a new group that I just started, thank you, for trauma-informed educators. So if you're interested in being a part of that, just email me and I'll get you in the group. Or if you are in the group and you have other colleagues that want to be, you can just add them in there. And all we're going to do is focus on education and trauma-informed education. As you guys go through life, you're going to be like, I wonder what my colleagues are doing with a kiddo like this. That's a great place for you to type that in and for everybody to weigh in on it, and we can have some consulting and helping and supporting. Okay? All right. What's up, Kathy?
Closing my email.
Oh, okay, gotcha. I don't know, we like knowing every time you get an email. I need it to ding all day. All right. Okay, what is traumatic? The same event can be experienced, adapted to, and carried forward in different ways by different children. So it's the response by the individual to the experience or event that is traumatic, not the event itself. So what does that mean? So if I'm in a car accident, let's say we're all in a bus, all of us in this room, it's a big bus, and we get into a car accident. Every single person in this room is going to have a different reaction to that, right? It might be my first car accident ever, and maybe I'm injured and I'm really scared. It might be someone's third or fourth or fifth accident, and they might not have the same experience as I do, right? So keeping in mind, a child, how many of our children have witnessed divorce? Divorce looks a lot different for every kid. And I use that one because it's a common thing, right? So it's the experience itself, it's the response to the event by the individual that is traumatic. Make sense? All right, how many of you have heard of Dr. Perry? If you were here in the first session, you heard him. Okay, so I'm a big fan because he talks a lot about early childhood and how trauma impacts development. So just because a child, and I had this happen with one of my clients, so she had been molested. Well, the people in her life are focusing on the fact that she'd been molested being very traumatic. Absolutely traumatic, right? But at that point in her life, that was not the most traumatic event she needed to deal with. Her dad had just died. So we needed to focus on the death of her dad and not on her molestation. Not that that wasn't a traumatic event, but to her, in that moment, the grief of her father was more important. Does that make sense? So keep that in mind, okay? We don't want to generalize just because they went through something and considered traumatic. All right, traumatic event happens, we have prolonged alarm reaction, we have altered neural systems. So especially for kids who've been in really traumatic situations from 0 to like 7, 8, 9, their physiological response, their chemistry is different. How many of you have ever been really amped up because you did something very exciting? Anyone ever felt that? And it takes you maybe a couple days to kind of like chill out, or a couple hours, right? So you know there's like this physiological response. And you're like, oh my gosh, when am I gonna even out? I gotta get back to normal. Well, for kids who've been through trauma, they spend months, weeks, years in that response, and that becomes normal for them. So we're merely rewiring the brain with the interventions that we do. Small potatoes, right? So keep that in mind that sometimes when you're talking to a child, one child is going to be pretty amped up and another child might be pretty calm if they've gone through the same experience. And sometimes that's because one has been in a traumatic situation for a really long period of time. They might not know what normal is. Any of you have kids who will sabotage intentionally? Part of that is because when things start to feel normal and good, they don't know what to do with that. They don't have any of that experience stored in their brain, and they're like, that's not normal. And we're like, yeah, it kind of is, right? Okay? All right, the brain matters. We talked about that. 90% of the brain is organized in the first 2, 3, 4, 5 years. Well, before they get into kindergarten, right? Which means that their memories are stored in their brain. They might not be able to articulate them. They might not be able to verbalize them, but their memories of what has occurred is stored in their brain. That's really important when you have kids who are acting out, because sometimes they don't even know why they're acting out. Experiences in the first 2 years of life have more impact on development than any other time. Okay, so let's talk as a group. What happens in the first 2 years of life? This is Isabel. Meet Isabel, for those of you who haven't met her, okay? I find out I'm pregnant. I'm carrying Miss Isabel, right? What's happening in my womb? Growing. Her body's growing. Her brain's developing. She's hearing. She's having a sensory experience, right? What is she hearing? Gotta speak up. Heart rate, tone of voice, everything that's going on with me, right? Okay, baby is born. What happens in the first year of life? What does baby experience?
Sensory experience is based off of what they're experiencing in the home. So say I'm a mom who's really, baby cries, I'm right there, I'm very attentive. That baby will experience things differently in development than if I were a mom who was like, I don't care.
Right, absolutely. So the environment that a child is born into creates what the child is experiencing, 100%, right? So let's talk about healthy baby first, okay? Healthy baby in first year does what? Cries. And if she cries in healthy home, what happens? Right? Response happens, okay? How much do they grow in that first year? Leaps and bounds, right? Like you can't keep them in clothes. You're always shopping, right? Okay, how much do they eat? Constantly, right? How much is their brain developing? What are they learning in their brain? They're viewing the whole world, right? And then they start crawling. Well, they roll over. So their body is getting some movement, okay? And then they start crawling. And what happens when they start crawling? Besides the fact that parents get exhausted. And you start moving all the things that are breakable.
They start interacting with their environment.
They're definitely interacting in their environment, right?
Major sensory experience is like the texture of the
Yeah.
carpet, the sound, smells.
They're taking everything in, right? So I have this client I work with, and they share this great story about bringing their child home from overseas, and she'd never experienced the wind. She'd been in an orphanage for the first year of her life. And so she got out and she was like gulping it all in, and just didn't have any idea what that felt like to have wind, cold wind on her face, right? So sensory experiences are happening all kinds. And then by the time they're 2, they're toddling everywhere, right? Their language is developing. They're learning the word no because we're saying it over and over and over, right? They're pushing limits. They're trying to be independent, but they're going to come back and check in. Does that fit for everyone who works with kids, right? So lots of experiences have happened. Now, put Isabel in a home where not attentive, not healthy, not available. How much of those experiences are happening for her? Those experiences in the healthy home happen because there's a caregiver who is stimulating them, right? How many of you have sat on the floor with your kid and you're like, roll over, come on, you know, and you're like helping them and you're trying to get them to do that. Think of all the stuff that's involved, and then you have a kiddo who doesn't have that. Some of the kids who come into our classrooms maybe weren't toilet trained until 5 or 6. Some of them never even crawled. Some of them just started walking, right? Some of them didn't have those experiences where there was someone who really wanted them to perform and to do the things that we as healthy people want our kids to do, because it's good for development. Okay, so keep that in mind. Those 2 years are very, very important for development. All right, will someone please loudly read that?
We are unable to engage in random actions because our behaviors are guided by patterns established through previous learning to which we automatically return.
All right, that's a lot of words, but what does it mean?
We don't do things just randomly. There's a succession of building just doesn't come.
Right. We learn how to behave very early on in our life. Now, have any of you ever worked with children, you tried something new, and you're really frustrated with them because they're not doing what you've told them? You might have even said something like, oh my gosh, how many times have we talked about this? You're doing it again. Raise your hand. We're not alone. And that is because we naturally go back to what we know. Okay? I grew up in a home of yellers. Lots of yelling. I have done this work for a long time. I teach other people how to interact appropriately with other people, with children, all that good stuff. I yell at my kids when I'm stressed. It's what I do. And then I'm like, oh, I went back to what I've always known, right? And then I blame my parents. I'm just kidding. All right, so for those of you who are in session 1, we know that this is Bruce Perry's model of the brain, right? So it's upside down triangle, okay? Very bottom of the triangle is called the brain stem, and it's completely responsible for somatosensory, right? All that sensory experience we were talking about. Taking in the world, learning all the sounds, all that good stuff, okay? Somatosensory, brain stem, totally developed by 9 months old. That's 9 months. That's young, right? So it's developing in utero. All right? Second part of the brain, completely responsible for self-regulation issues, and that is your diencephalon cerebellum, the midbrain. Any of the kids you work with have self-regulation issues? Absolutely. Any of the adults, coworkers, spouses? Right? That's when you say, oh my gosh, you're acting like a 2-year-old. Right there, my friends. Right there. We know where that is in the brain. Okay? The next part of the brain is your limbic system. And that's all about relationships and affect and how we relate to other people. Peer problems, okay? And then the upper part of the brain is the cortex. And that's all of our higher level of thinking. Now, I kind of have this rule of thumb that when kids turn like 3 or 4, we kind of think they know a lot more than they do. And we speak to their cortex a lot more. Because they're talking back to us, so we think they can understand us, right? And we're missing the boat. Their cortex isn't developed yet. The cortex is not fully developed until 21, 25 years old. There's a lot of research out there. Okay? All right. We're going to take a brain break. What are brain breaks? For those of you in session 1, I'm asking you to apply some critical thinking skills. All right, how many of our kids sit all day long? Okay? And it's really hard to sit all day long. So today what we're going to do is we're going to apply some brain breaks. We're going to take some breaks. We're going to have you guys try some of the things that you guys can do in your classrooms to help kids get moving. Because once you stimulate your body, you get moving, you can come back down and you can be more focused. Okay? So, everybody gets to stand up. I always love when people go around the fire. Okay. Alright, so what you're going to do until I say stop is you're going to wiggle your body. And it can wiggle. I want arms moving. I want legs moving. Head moving. Shoulders moving. Maybe toes. Okay, I want ankles moving. Just keep in mind, if you ask your kids to do this, you need to model it. Alright, keep moving. Look at this crew. Alright, done. Thank you. Do you see what just happened? Now everybody's smiling. Maybe they're mad at me, but they're smiling. You're talking. You look like you're not bored. Okay, this is all good stuff. All right, so we are gonna watch a little movie, 22 minutes. I think it might be 22, maybe 23. This is gonna give us a good little summary from session 1. It's different than the movie we watched in session 1, so you don't have to watch that one again. And then we're gonna talk a little bit about brain development. And then we're gonna move into strategies, because that's really what you guys are here for, is both of the strategies, okay?
Everything that's important about life as a human being, you learn in context of relationships.
We need somebody that we can trust, that we can hold on to, who walks with us hand in hand through the whole deal.
Brain research gives us the new lens in which to begin to look at children's behavior and the meaning of their behavior in a completely different way.
They'd found that if you took a little rat pup and you held it, a human being held it for a very brief period of time, which was stressful to the rat, and put the rat pup back in the litter with the mother, let the rat grow up, and then looked at its brain, it was different than animals that hadn't been handled.
Early in life, many of these connections in the brain, what are called synapses, develop based on genetics, but also based on how experiences occur. And then throughout childhood, the changes in the brain that occur in an interaction between genes and the experiences kids have.
The research on the brain has for the first time given us biological, physical proof that interactional processes that don't go well, for example, impact the brain profoundly.
If the brainstem, for whatever reason, has some insult during development, it could be alcohol exposure in utero, it could be cigarette smoking, it could be prenatal exposure to drug, or it could be significant distress in the caregiver. For whatever reason, if the brainstem is poorly organized and overreactive and dysynchronous, the baby's born, and very often they will have what we call a state regulation problem. They are hard to soothe. You can't quiet them down very well. It's hard to engage them, and it makes the caregivers feel overwhelmed. They can't calm the child down very well. The child stays all stirred up, and instead of having this smooth, synchronous interaction, you have kind of this bad fit.
When a pregnant mother is under constant stress, you know, she might just be stressed at the office, but her brain and her body and her developing baby's brain don't know the difference between that and that there are predators in the environment. So we're seeing babies being born that are hyperreactive. Why? Mom's under stress during her whole pregnancy, either through work or through being unsupported by her community, by her partner, by her family, whatever. So we have this baby born that's already hyperreactive.
The attachment bond between the parent and the child is really the carrier of all development, and the regulation that a mother provides, the soothing that the mother gives to the baby, the calming of the baby's nervous system. If she can do that well, the baby's nervous system will learn how to regulate itself. If she cannot do that, if she herself is all unregulated, if she is sick, if she is in marital discord, if she's depressed, she cannot attend adequately to her baby to where the baby feels like there's somebody there watching out for him or her, then the baby goes into these heightened states of hyperarousal and dysregulation, and the body, the template of that, is being set.
Attachment relationships where the parent is sensitive to the child's inner state lead the child to have a brain that becomes very integrated and a mind that is very coherent.
What our bodies want for best development is relationship. Every neuron in our brain develops most optimally through a loving relationship.
The most important pivotal experience in a child's life is that a caregiver and a child have a falling in love experience. And that experience of joy is invigorating to the body on all fronts, and is essential to being able to develop the capacity to care, to be able to develop the capacity to love, and to have empathy for other human beings, and to be able to have moral conscience.
Relationships are the absolute heart of humanity, and we are neurobiologically designed to be in relationships. We are neurobiologically designed to be able to read and respond to other people, and we're neurobiologically designed to reach out and seek relationships with other people. And when we have these opportunities to form healthy relationships with family, with neighbors, with coworkers, with members of the community, we're healthy. And when we don't have those opportunities, we literally are physiologically at risk.
Children, infants are not soothed, repeatedly not soothed by their parents when they're in distress. That impacts one of the chemical systems in the brain, what's called the cortisol system. And cortisol is a natural neurohormone for calming arousal down, calming distress down. And if an infant's not soothed, then they increase their cortisol levels to try to make up for the lack of soothing by the parents, self-soothing. And then because high levels of cortisol are dangerous to brain tissue, it resets the thermostat. And that as a result of that, through the rest of their life until recently, we thought it was permanent, the thermostat is set so that they have less cortisol and less capability of handling distress. So they're more prone to getting upset, more prone to staying upset once they get upset.
If parents are not providing sensitive caregiving, where they're not tuned into the internal state of the child, then you have various kinds of difficulties that can arise.
Developmental trauma, including neglect, has as high an impact over the lifespan as a single incident trauma.
Developmental trauma or ambient trauma is trauma that's just everyday life. It's in the neighborhood, it's in the household.
It is at times very confusing to the adult world the way children respond to traumatic events, and it's very easy for adults to dismiss the profound impact that a traumatic event can have on a child, because very often they will do most things pretty well.
There's a strong sense that children are there to manipulate us and to be willfully disobedient. And instead of really understanding the child from the child's point of view, I think we've imposed something from the outside, almost adult characteristics onto children.
One of the single most important understandings that parents can have is to realize that trauma creates fear in children, and anger has an underlying element of fear. And so instead of focusing just on the anger, we can address the fear in children and calm and soothe the fear that will make the anger go away, rather than just focusing on the anger.
Children who have experienced some type of trauma often have symptoms of ADD.
These difficult behaviors are really stress responses, and it's up to us to figure out what is causing these stress responses. And there's several different pathways that they can show us that they're distressed. The first stress response is a hypersensitive, hyperreactive stress response. And these infants cry a lot, are inconsolable. When they become toddlers, they may go into rapid temper tantrums and be very volatile. A second stress response are infants who are hypervigilant. These infants will have very wide eyes and will be very vigilantly looking, and you can see that there's an anxiety in their muscle tone and in how they carry themselves, and that they're scanning the environment. A toddler may be overly clingy or overly withdrawn. A third stress response would be very shut down and tuned out. These children, again, may be misunderstood as a good, easy baby.
There are equal number of children who are too good, too quiet, withdrawn, who demonstrate the cool side, the shutdown, the frozen side of trauma. Most teachers, most educators at this point still don't recognize those kids, and they often become as problematic or more problematic than the more obviously upset kid.
You can't always tell when a child has been traumatized. Very often they may be going through the day interacting normally with their peers. They'll be playing games, they might be laughing, and you may not have any idea that that child the week before lost their parent in a violent event. However, if you follow that child long enough, what you'll find is that under the smallest challenge, they'll unravel and they'll unwind. And it's not always predictable. They may handle one situation very well and then completely collapse in something that seems pretty minor.
When an attachment figure is the source of terror, the child's brain has two processes going on at once. One is the inborn attachment system, which says, I'm in a state of alarm, I need to go to my attachment figure for soothing. But if that attachment figure is the source of the distress, and I don't just mean being upset and you don't get ice cream before dinner, I mean terror, then what happens is the child will then try another track in the child's brain will state, do not go toward that figure, that's the cause of your distress.
Parents are unaware of how that they can traumatize their infants or their toddlers, and then they're unaware of what their children's signals mean.
People who are traumatized are stressed, and the stress doesn't go away. The symptoms don't go away. They persist in one way or another, either as a psychological problem or as a learning problem or as perhaps a physical problem in the body. For years and years and years, they never disappear. They come, they go, but they're always back again. That's trauma. That's stress at the level of trauma.
98% of parents who have children who have been traumatized have also been traumatized themselves. So healing the parent's trauma first allows them to create an environment for the healing of their child's trauma.
If you really want to understand how a child is functioning in the present, you need to understand their personal history. Because the brain, more than anything, is an historical organ. It stores experiences. So if you understand the personal experiences of the child, you will understand a lot about how different systems in the brain are organized.
We look at the whole person, we look at their whole history, and we look at their development. We look at what's happened in their body, in their life, in their social structure. We look at all the aspects of their life, and then we determine where to go from there.
One of the most important factors in a good developmental history is getting some understanding and some insights about the child-rearing beliefs and practices of their caregiver, which you can usually get by asking them about their family and the way they were raised.
We have to work with parents who can feel good enough about themselves so that they can allow their children to feel good enough, then there won't be the kind of abuse.
It is essential to treat the entire family when healing trauma in children. Without healing the trauma of the family and creating awareness for the family, you can't heal the child.
It's a parent's own self-understanding that is so crucial for the quality of the relationship with the child. Trauma is like a dog bite, in the sense of when a dog bites you on the fingers, your natural instinct is to pull your fingers away, and unfortunately that will create more damage to your skin. What really you need to do if a dog bites you in the hand is thrust your hand into the dog's mouth, which makes the dog gag. Now, I know it's very graphic, but it's the same thing with trauma. Parents need to know it's important to go into the trauma, into the mouth of the trauma with your mind and with the relationship, so that it doesn't dig its teeth in and yank the flesh of your soul away.
First of all, we have to get our children and our infants back into a condition of safety. That may be that they need contact with a safe relationship, that maybe they have had a disruption and they need to maybe not go to school that day and spend time with mommy, and maybe mommy needs to not go to work. and just spend time with her child. So they need to get to regain a sense of safety if in fact that has been their baseline. One of the ways we help infants and children regain a sense of safety is to start to become what I call a sensory detective. We need to start becoming really aware of what sensations are reminders of that traumatic event, and they could be sounds, they could be tastes, they could be something visual, they could be a particular movement, a particular touch. And we're going to reintroduce a sensation that has been very traumatic or that triggers a traumatic memory. We want to be very clear that we give the right dose that the child or infant can handle. So it's going to have to be very small increments of helping them be able to experience that sensation, recover from that sensation, get back into safety, and then slowly go back and forth between a sense of fear, feeling out of control, and then being able to get back in control and safety. And the fourth is to increase the child's surround of sensory comfort so that beyond the caregiver, there can be many arenas of sensory comfort that the child or infant can surround themselves with, whether it's music or a particular touch of a blanket or a particular toy that they hold that they feel safe with.
The next phase, though, is to tell the story of the experience, to make a narrative of it, so that other parts of the mind, and the brain, if you will, the left hemisphere, can join in the process of making sense. It also involves the verbal aspect of the creation of a story, from before the trauma happened, what happened at the time the trauma began, what were the elements of the experience of the trauma, what was the most frightening part, how did the trauma resolve,
what surprised them, what they didn't expect, what their body felt like, what it felt like in their body, what it felt like in their emotions. Can they tell us what those emotions are? Can they get pictures and put together the story?
What the narrative experience tells us is that what's shareable is bearable. And so when a person can bring it out and share it with another, then it becomes more bearable than keeping it to yourself.
A lot of the trauma that has happened to children happened before they were verbal. There's no way we're going to work with that verbally. We have to get into their senses.
With infants and young children who are pre-verbal, there is still a way that parents can communicate to the child that they are understanding their child's distress and the importance of that. And they can communicate the story and the narrative of understanding, I understand what happened to you, even though the child may not completely understand the language of it. They will understand the tone of voice, they will understand the rhythm and the rate in which that's communicated.
Half of our brains, our right half, can only speak the language of the nonverbal. And the nonverbal includes eye contact, then there's facial expression, tone of voice, posture, gestures, and timing and intensity of response. Those nonverbal signals can be taught to parents, and they can use them to understand what's going on with other people, and especially what's going on with young children.
Early childhood trauma changes the biology of the brain. Well, early childhood support also changes the biology of the brain.
What studies of resilience show that even when children have insecure attachments in the home, if they've had at least one secure attachment with a daycare provider, a preschool teacher, or another adult in their lives, then that makes a huge difference for them having the seed of resilience. They may still have difficulties, but because they've had that one secure relationship, that relationship where they felt that another individual, another adult, knows them and feels what's going on inside of them, those kids have the potential to do very well in the future.
We can see imaging today of before and after trauma and see what happens in the brain, and we can also see repair that happens in the brain when our interventions have been successful.
What makes children get better following a trauma is connection to other human beings who are present, who are patient, who are kind, who are sensitive, and they don't need to be necessarily psychologically insightful. They don't need to know anything about trauma. All they need to know is that they're right there with this child, they're trying to be comforting, they're trying to be supportive, they're trying to encourage. Those kinds of interactions end up being much more therapeutic and healing than many of the other things that we try to do with kids.
Teachers can look more at their children, be more emotionally present for children, touch them, work on their own nervous system and their own regulation. If they're angry and they're out of control in terms of what's going on inside of themselves, the message that they're going to convey to the child is, I'm angry and I don't like you.
If you're an adult and there are children in your life, whether you're in law enforcement, a teacher, a parent, a foster parent, whatever you are, and you know that a child has been exposed to something that's potentially traumatic, the first thing that you should be aware of is that not all traumatic events lead to disastrous mental health outcomes. In fact, the vast majority of children that are traumatized actually do pretty well, but they do need your attention, they do need your kind support, and they do need your awareness about what are warning signs that would tell you to actually take the next step and try to get some professional help.
It's up to us. We can't wait for a they to do this spreading of the message that we can do something about it, that children, especially young children, have the most possibility for health and plasticity, for overcoming these early traumas if we as a community, a large community, support them.
We have permission now to meet children's needs. We have permission now from neuroscience to give children what they need, and to me that is so exciting.
If there was one place I would like to start with individuals as well as our society trying to make a difference, to really stop the cross-generational passage of trauma and of insecure attachment, it would be for parents to start a process of self-understanding. It basically costs nothing except the time and emotion that it takes for parents to begin on that process. And we all can do it. And the people who benefit most, besides ourselves, are our children.
We're spending literally 95% of our public dollars to change the brain, because that's what mental health is. That's what public education is. That's what juvenile justice intervention is. All of these are trying to change the brain. And we're spending almost nothing in the first 5 years of life when the brain is easiest to modify. And it takes the least amount of professional input, the least amount of insight. It takes just high-quality caregiving.
It's us, not they. It's each one of us doing it now, not later, but now.
So I showed this to you for a lot of reasons, and I know it was a lot about parenting, but I think that it applies to educators in a lot of different ways, because even if you work with kids who are 15, 16, 17, it's really important to remember the brain is a historical organ, right? When we have an understanding of where kids have come from, then we can do better at meeting their needs. Does it make sense? Okay, what stood out for you in the video?
That relationships really define
which makes sense now, but just trying to put the two and two together.
So the value of our relationships is defining how our brain develops, right? I mean, relationships directly impact brain development. So I can't tell you the number of educators who've come to me and said, Stacy, I don't know if I should focus on emotional issues or academic issues. I twitch a little, right? Because we have to focus on relationship. And especially as educators, when you're with these kids, and the kids who are struggling the most probably have the least amount of positive relationships in their life. And you might be that person. So, okay, what else stood out for the video?
I guess the thing, and I mean, we know this, but we don't always formally talk about it. We always talk about what's wrong, like trauma happens, right? The part I think that stood out is that with all the trauma in the world, if you have a positive relationship, you can be very resilient and be very functional and be very successful, because trauma does happen to everybody.
Yeah, I mean, part of being human is getting through life scarred and wounded. I don't think there's anybody in here who hasn't experienced something, right? Tragedy happens, but when we have strong relationships around us, then we can get through that. And when you're a kid and you're kind of swimming through life and you've had lots of really horrible things, and you find one person you can connect with, wow, that's like a life jacket, right? That can hold you up, okay? What else stood out? Hold on, you hold her first, then you.
Sometimes, you know, like she said, things get very chaotic. So we, you know, are so worried about the chaos that the ones who are being quiet, you think they're the good kids. Thank you for being so good, but really, they might have some issues going on as well. They're just not speaking about it, and so that kind of stood out to me to focus on a little bit better.
Absolutely, I think they did a very nice job of bringing that to light, because as educators, you have a lot of classroom management to happen, right? Like you're herding kids and getting kids where they need to go and making sure that certain standards are met for teaching and all those things. And so sometimes it's hard, it's easy to pass over those kids, right? And I think we're going to talk a little bit more about dissociation today, but that starts in infancy. So kids learn how to check out when they're infants. And that's because they don't have that relationship connection. Okay?
One of the things, and it's something that I knew, but it's really good to be reminded of it, is how if you're upset, even if you're trying your best to hide it, that telegraphs to the child. So if you're upset about something going on in your life, really stressed, that telegraphs this to the child, whether you're showing it, you can give the child that happy face, but your body language and your tone may not reflect what you're feeling, what you're trying to get across.
Absolutely.
Feel.
Yeah.
And that child can think, okay, well, they're mad at me or they don't like me.
Right. How many of you have been hooked by a kid? They have hooked you. Hook, line, and sinker. You've walked into their crisis and you become part of it. Right? You don't work in this field if that hasn't happened to you. And part of that is because we're not always aware of our own stuff. And then afterwards we're like, I don't know if I want to go there and deal with my own stuff. Right? So it's important to remember that what we bring to the table is part of the relationship. The relationship's not one-sided. It's two-sided. Okay? What else stood out?
I think that teaching kids to talk about things, that it's okay to talk about it, is something that I pulled out of it. You know, that it empowers them if they can talk about it, and it starts lessening for them, and you know, but teaching them that that's okay, because it seems like society's taught us how to hide things and sweep stuff under the rug, and well, if you don't think about it and don't worry about it, just set it aside. But that's not true.
No.
You know, to teach them that, you know, it's okay. It's okay to talk about it. It's okay to voice it. It's okay to, you know, say that, well, this sucks, or, you know.
Yeah. I love that quote. If it's shareable, it's bearable.
That's right.
I love that, because we really live in a society where we don't share much, right? We're kind of taught not to talk about things, and that's not helping us at all. And it's really not helping these kids, because part of what happens is stuff that happens pre-verbally, they just kind of think that's part of normal life. Like, they don't know any difference. And then they might get triggered themselves and they have these feelings later. They don't really know what that means. But if we as adults are not sharing either, we're not modeling how to do that. right? So if you come to my life, in my practice, you'll hear me share all sorts of stories. And that's part of my therapy style, is because if it's shareable, it's bearable. When people hear that I'm human and I've been through really difficult things and I'm still okay, people start to say, oh, maybe I can share my story. Maybe I can tell you. And some of these stories are horrific, right? We're talking sexual abuse, and we're talking, you know, I've had kids see his parents murdered. I mean, those are heavy type things. And how do you even get those words out? Like, I watched my dad kill my mom. That's heavy. And so you might be that one person they're ready to share their story with. And if you don't provide that opportunity, then we're missing a chance for them to have one step towards healing. No pressure. Okay, what else stood out? All right, so we're gonna do a little video rating. Thumbs up, you liked it. Thumbs down, you hated it. Somewhere in the middle. It was good? Okay, I took a risk. I wasn't sure how you feel about it. I know, Dan Siegel's a little intense. Right, Dan Siegel? Like, into the throat, flesh, you know? Like I also do think that part of behaviors is really that trauma in action. And so if any of you have ever felt like you have to walk on eggshells with a kid, that's an indication that it's time to go into the trauma. Okay? You don't want your flesh ripped out of your soul. It was a little bit crazy, right? Okay, so we're not doing too many formal breaks today because we have not very much time. But when we break out into a little bit of sessions, if you guys want to take a break at that time, that's a good time to do that. Okay? All right, so we're going to move into blueprints. So when I think of the word blueprint, I think about a house. How do you build your house? You have a whole thing of blueprints, right? Well, we're very much the same way. Now, this is day 2 of a discussion around trauma. I'm asking you to go a lot deeper today. And I also want to recognize that there might be people here you don't want to share stuff with. So I don't want you to go so deep that you can't put yourself back together. All right? But I do want you to do some reflection, and I want you to leave here with a little more insight as to what you bring to the table of relationship. Okay? So we all grew up in some sort of home. Fair? We all have some family. It might be defined very differently. Okay? Family might be mom and dad, family might be grandma and grandpa, family might be foster home, family might be adoptive family. Like, there's lots of different ways to define family. And that's okay. Everybody's a little bit different. But I really want you to think about your blueprints in the family that you grew up in. All right? So I'm the oldest of 3 girls. That's part of my blueprint. I've been told that I'm bossy my whole life. I've now turned that into executive leadership skills. And I'm passing that on to my daughter, who is also the oldest daughter, and her brother calls her bossy all the time. And I'm like, don't call her bossy. She's a leader. Do what she says. She's right anyway. Right? Okay. So, what did you learn growing up about expressing feelings? Oh, that's that feeling word. What did you learn? What was modeled for you? I want you to have a little bit of a discussion about that, because we're going there today. Like, if we can't deal with feelings in this little group of 50 people, we're kind of screwed. Because we have kids live feelings. Kids are feelings in motion, right? And we got to be able to handle it. So I want to know what you bring to the table. So talk amongst you. What did you learn about how to express anger, how to express loss, how to express sadness? Go. So there was a couple good questions. So one was, what if you don't remember? Right? Well, that's a fair question. Some of us choose not to remember. Some of us don't want to remember. And some of us might have just grown up in really healthy homes where it wasn't really a big deal. And we were learning how to do healthy stuff. That's great, right? So what did you guys come up with? Share some examples of how you learned to share your feelings in your home.
Well, I think back, I had a mom and dad who were like the opposite. So we could never do right, I guess. If we did it mom's way, we got to go with dad.
So you got mixed messages.
Right.
Right? So that getting mixed messages, like how many had homes like that? That happens, right? That's confusing. I always say that, and I think we talked about this in the first session, like kids learn how to walk generally the same way. Did we cover this? Right? When you look at the world, most people walk one foot in front of the other. Now, there's exceptions to that, we know that. But when you're a kid and you're watching people walk, everyone is modeling that the same way. But when you get into the emotional side of things, I guarantee every person in here expresses sadness differently. Expresses anger differently. Like, I'm a passionate, angry person. I'm a thrower. I need time out. Like, I get angry. And my husband's like, I feel mad. I'm like, what do you mean mad? Mad, you know? And we have to like navigate that. So then our kids are kind of like, I don't know what anger looks like. Right? So we are expressing emotions in a very different way, and that doesn't look the same. When you're a kid looking up at the world and you're trying to figure that out, and everyone in your life expresses it differently, it's a lot different than walking. Right? Okay, so you had mixed messages. What else?
We were talking, and our parents were divorced, and we don't really have a lot of memories, you know, of them together, so it wasn't that big, you know, but like she was the big sister, so she, you know, did a lot for her sibling, and my sister raised me a lot, but you didn't, I mean, the main thing was you didn't tattle, you behaved, you know, like, we didn't really talk about anything, you know, you behaved, you put a smile on, and you acted like you were supposed to, or you went and sat down, you know, and...
Absolutely. So how many of you grew up in homes where you were to be seen and not heard? Well, that is kind of a pickle when you have a feeling, isn't it? Right? Okay. What else?
We were pretty actually similar, depends on what I find out. When we had a feeling to express to our parents, this example is perfect for anger, we can express ourselves, but we have these set parameters where you kind of know what you can, how you're supposed to word your feelings. I guess that's an older kid thing, maybe, but yeah, we can talk to our parents, but we had to do it in the right parameters, and those parameters were set for us at an early age, I guess.
So there were some guidelines you learned early on.
Yeah, there's some things you don't want to say, some things you want to say.
Don't be like disrespectful when you're angry.
Right?
Don't use the wrong words sometimes.
Right. So I remember when my daughter was my oldest, you know, girl daughter who's very bossy. She was 2, and my mom came down. She was helping me, you know, we were spending the weekend together or whatever, and she said, Stacy, you sure let Stella say no a lot to you. And I thought about that for a little bit, right? And I thought about all the stuff I know, about all the stuff we're talking about. And I came back and I said, so Mom, I get a sense that you have some things around the word no, right? Like she had grown up, you never tell your parents no, right? Which I think a lot of us grew up in that way, right? So our parents said something, we did what they said, no questions asked, period. Well, I shifted that a little bit for my mom and I said, Mom, I hear you, but if she can never say no to me at 2, how in the world is she gonna say no to that 16-year-old boy when she's sitting in a car with him? Right? And she was like, I never thought about that. I was like, well, our kids learn those skills from us, and if they can't practice them with us, how are they going to apply them? And quite frankly, I want her to say no. I want my son to say no. Like, I want them to be able to express that. So our house is kind of a lot of expression, maybe a little too much sometimes, right? But it's important to be thinking, what did I like about what my parents taught me, and what do I want to do, what do I want to shift? Because we bring that into the classroom whether we like that or not. Whether we want to or we don't. And these kids will figure that out. Okay? What about happiness and joy? I bet most of you talked about like anger, sadness, grief, all those things, right? What about happiness and joy? Did any of you celebrate good things in your family and express feelings growing up? Okay. Good. That's good. We want to make sure we have that balance, right? Okay, so I'm going to take this a little bit further. How are feelings expressed in your classroom? What's okay? Talk about it. All right, so what did you come up with? Anybody have any brilliant ideas of how they can express feelings in their classrooms?
We have, she
also said it was like a joys and concerns thing where the kids can put anonymous joys and concerns inside of like a little box in the classroom, and it gets pulled out during like a specific circle time and gets discussed a lot around them. And we have, in the classrooms I've worked in, it's been kind of an anonymous thing, so there's no animosity towards any of the students. Another classroom I worked in, they did like a quiet couch, so if a kid felt themselves getting upset or whatever, they could go and just take a seat on the quiet couch and nobody would bother them.
Got it.
It was kind
Great
of like,
idea.
this
So
was
joys
a
and
safe
concerns.
zone.
Good. Joys and concerns and a quiet couch. Okay. Awesome. Thank you. Any other ideas? Oh.
So our district is probably not really super awesome supportive when it comes to talking about feelings. They're really good at talking about behavior, but not talking about feelings.
Hold on just a second. Pause that. Anyone else have that?
Yes, that was very well.
Okay. Thank you. Okay. Go ahead.
So like one of our universals is say okay and do it right away. So that whole not allowed to say no thing is very much prevalent. And sometimes that's trash. Like sometimes they need to say no, this is too hard, no, I'm not ready. There was talking about a student the other day who said, you know, I'm having a rough day and I really need today off. Sorry, that's not a choice, you need to do your work. Never validated. And that was a great thing for the kid to say.
Right.
That's a really important message, and they're telling us something and telling us that.
Right.
It was not validated, it wasn't accepted, there was no inquisition, nothing. So I think they had a really hard time understanding that, you know, behavior is communication. It's probably communicating a feeling, and it's really important for us to work with that. They're also not good at being honest with their kids when they're in a bad place.
Right.
They want to plow, 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 plow. And they set the climate of that room. They need to be aware of it. They need to be honest about it.
Right. So great points, right? We as human beings struggle with our own self-awareness. That's why we're having these conversations today, because we really do drive everything. So if I show up today, I got 50 people here and I'm like, here we are, let's do this. You guys are gonna be like, why am I wasting? Right? I mean, I gotta be able to put my crap away and be present. And I think as teachers, sometimes that's hard to do. And there's so much that happens during the day. Maybe there's an interaction that happened with a staff person, a colleague, right? And you gotta put that away and come in and be in front of people. But I think those are the moments where you can have that vulnerability and you can say, anybody in here ever have a bad day? And everyone in your room will be like, yeah. And you can say, I'm kind of having one right now. How can we support each other? How can we take care of each other? We do this with kids as young as 3, 4, and 5, all the way through high school and college, right? And what you find is that's when you start to have those human connections. And it goes back to the video and what we talked about in the first session is creating safety. Bottom line, if I don't feel safe with you, I ain't gonna talk to you. And if I don't feel safe with you, I'm not gonna learn. So it's absolutely about, oh my gosh, this kid probably stood up for himself, first time in a long time, was able to express what he needed. I'm assuming it was he, she, a child, he. Expressed what he needed, and then the adult didn't know what to do with that. So sometimes we have policies in our schools that aren't real friendly, right?
See, we have a leader this year. We have a new leader, a new principal that's totally supportive of that. So it comes from the top down, and it has been probably the most amazing year in the 13 years I've been there that we've ever had, because he's about that. If the kid needs that minute and he's willing to say, look, I got this going on at home. I need to shut down right now. I can't do homework. My mind won't, I can't do it. And he says, that's okay. Wow. You know, so it's amazing to have that support.
And recognizing that there's room because I'm a counselor that works with him directly a lot, and recognizing that yes, we have policy and rules, but human beings are not one size fits all. No. And keeping in mind, you know, the backgrounds and other things going on with these kids that are much bigger than just, you know, keeping school happy, you know?
Yeah, absolutely.
Well, I think it goes to what we're here, why we're here today is, at least I work with all the administrators a lot, and I find that it's not that they don't want to be that person, they just don't realize the culture that they may be supposed reporting, they don't even know. I mean, you know, they're not aware. And because I have a lot of conversations and I do see change. You know, it happens. It's just how do you reach them? How do you like get them to say this is an important part of my agenda, and then how is it implemented down the road? And it's interesting. It does come from the top, but it also is interesting how to make that happen.
Right.
In a bigger picture and in a bigger organization.
Right.
Those kinds of things.
Absolutely. So we're talking about a lot of system issues, right? And so anytime we get to system issues, I'm like, I want to change the world. We're going to fix it all. And I myself cannot do that by myself, right? So I get to come talk to all of you, and then we're going to have a plan for you guys to go out and you guys to change the world. And so when you look at that, though, you can get really frustrated with a whole big system that's not supporting you, right? How many of you have worked in that system or are currently in it, right? So what we have to do is think, what do I have control over? What can I bring to the table? So maybe that means I'm a little bit more tuned in. Maybe I'm having those conversations a little bit deeper with the kids I know who are struggling. Maybe we're shifting some things in the classroom. Maybe we're going to change the environment a little bit. We're going to move desks in a safer way. We're going to create a safety corner for kids. And I hate the word corner, but a safety area, right? And we're going to have a sensory wall. Or you know, there's so many different things that you yourself can do. And it's how you're present with that child. That is changing it. And then you have those bigger conversations with your administrators and you say, listen, this is what I'm working on. This is what I'm doing. This is the success I'm seeing. These are the things I have challenges with. How can we partner together? I have yet to meet a person who's in education, who's in it for a really long time, who doesn't have a strong desire to help kids. Right? Most of us who've done this work for a long time, we get kind of warped and we get stuck and we get in these ruts, and then we have all the pressures and demands from other things that we have to do and we have to accomplish. We forget that we have control over us. So maybe at the beginning of every class, we do a check-in. Maybe we take 10 seconds and every person says, how you feeling today? How you rating today? This is why I do these kind of things. Because if I do a rating in a classroom with a bunch of kids and I see somebody go like this, I know I need to hang out with that kid. They don't have to verbalize that. No one even has to see that. But I see that and I know I need to chat with them. Right? So I have pet assisted therapy. I do animal assisted therapy. I have a dog, yellow lab, should be 95, he's about 110 pounds. And he hangs out with me. But prior to that, when I was doing school-based mental health, I had a black lab. And in our summer program, his name was Clever. It was a great name. He would come with me, and it took me about a week to kind of figure out what would happen. We'd get to school, we'd go in the classroom, take him off his leash, and he'd wander up and down the rows of the desks. And then he'd circle, and then he'd land next to a kid. And he'd sit there the whole day. And after the first week, I figured out he picked the kid who was struggling every single time. 100%. 100% on. I was like, he is clever. That was very well played. But what he was tuning into was heart rate. He was tuning into that physiology of that child. And what automatically would happen, he would sit next to the kid, and the kid would start petting him. So once I figured out that that was the pattern, I was like, we figured out how to give that kid more support. We connected more. We did more relationally enriched things prior to doing homework and schoolwork so that he could be present. Right? Okay, moving forward. I want to talk a little bit about discipline and punishment. How did you grow up in your family? And what do you do in your classroom? So, I'm from a family of spankers. We got spanked for everything. I mean everything. Right? You hit your sister, you get a spanking. Well, okay, that makes sense. I hit my sister, I get hit. Okay, let's move on. All right, so, I mean, it was just wild, right? So, I got grounded for life because I lied about a party in high school. I wasn't there, I kind of threw the whole thing. I got grounded for life. Like, we didn't talk about all of it, but I lied, so I got grounded. So, talk about how did you grow up? Like, what happened in your life, right? Share only what you feel comfortable with, but we bring that to our table. Right? We bring that, I mean, kids who drive me absolutely crazy, I want to kind of like grab their little, and I want to be like, you're going to be crazy! Because that's what would happen to me. And then I'm like, oh wait, I could kind of see myself looking up. And I'm like, that's not effective. That's not working. All right, 3 minutes, go. Lots of great discussion happening, okay? And I want to spend quite a bit of time on this because if we're not self-aware, we're in big trouble, like way trouble, okay? So, anybody feel comfortable sharing discipline issues, things that came up at home? What were you taught?
Some of the things we were taught was spankings, of course, you know, and guilt, like feeling guilty verbally, like our parents made us feel pretty guilty for the decisions that we made.
Like that was worse than any spanking I ever got, was feeling really guilty, or seeing my parents angry was really intimidating. Like I was just scared to make them mad, so I didn't really want to go there because I just knew it was a bad idea. Revoke of privileges was also a big one.
Revoking privileges, okay.
Yeah, work, chores. If you ever got in trouble, go to work. At my house, at least.
Well, we kind of have this thing at our house, like all things can be worked out to the wood pile.
Yeah.
Yeah, you know, and that's currently, like not as I was growing up. I currently do that with my own kids. Like, you're not getting along? That's fine. Let's go cut some wood, stack some wood, bring some wood in. I'm sure we'll all be working as a team by the end of the day.
Yeah, my dad owns an electrical company, and it's the same thing, you know, we just neighbor, you know, go sweep this, you know, go sweep the floor until you feel better.
Right?
Until you can make the right decision.
I'm sweeping that floor!
The floor's never been so clean.
Absolutely, right? So I think our parents were attempting to get creative strategies in there, right?
Yeah.
Okay, sir?
I heard the woodshed story too, but it wasn't to go clean it up. Just go out there and get a whip it, but I got spankings, and I was always doing something wrong when I got them. And it was their last resort of me not stopping what I was doing.
Right.
So I look back on it and I'm going, you know, I really did deserve those spankings, but what they taught me was that the consequences grow the more you continue to behave.
Say that one more time, sorry. The consequences of...
But the consequences increased for me. You know, it wasn't just that you can't do that, no.
Right.
Then, you know, I'm really getting angry about you doing that, and if you don't stop, the consequences are going to get harder. Then I got spanked, and my mom was a disciplinarian, and I didn't want her to tell Dad.
Yeah, right? Like how many of you had the threat of dad?
I mean, my dad didn't beat me much, you know, I got spanked in my life. But just hearing that was enough for me to not want to tell Dad.
Gotcha. Well, I appreciate you guys sharing this, because it's hard. I mean, sometimes it's hard to talk about this stuff. Like, it's not all warm and fuzzy stuff, right? Okay, anybody else want to share?
We learned in our house that Dad was abusive.
Ah.
So, Mom would ground me for a week, and Dad would let me off in a couple of days.
Divide and conquer.
Yeah. So, what it's done is that it's made me absolutely adamant now as an adult that I say what I mean, and I mean what I say. And if I tell you this is your consequence, it's going to be your consequence.
Welcome to rigidity.
Of doing the unrealistic consequences I have never told a kid, like, ridiculous, you're going to be in recess for the rest of your life, kind of deals. That's just obnoxious and not good.
Right. And I'm just going to weigh in that I don't think we should take recess away. Okay, move on. So, all right.
With spanking and removal of privileges, what my parents could figure out when they were removing stuff, that they really should have taken my books away because they could have taken everything else away, but they always took my books.
Right.
So I wrote bookmark, it's not a big deal. There was grounding, they yelled a lot, and then my home, I told them, like, you guys can go take a break. Go sit on your bed. Go take a break. And the other thing is when I go to discipline now, I really look at it. I'm like, I'm not giving them a discipline, that's going to be a punishment to me. So, like,
brilliant.
During the summer, I'm not going to tell you you have to be in all day because that means I have to be in all day.
Right. That's good stuff. So, I mean, it's that what did we like that we learned growing up, and what do we want to shift, right? So my husband was raised in a family that talks about nothing. Nothing. Like, nothing bad has ever happened in that family, ever. They're in denial. And in my family, we're passionate and we talk about everything until you can't talk about it again, like, anymore. So we've been married for 17 years, and I finally figured, like, in the last 2 years, we're finally past that. Like, now we're kind of in the middle, right? At the beginning, I was like, I'm mad, I'm angry, let's talk about it. And he was like, what are you mad about? know. And so I'm like, how are we gonna raise kids with those two different blueprints? Like, we gotta be on the same page, right? So how do we take that to the classroom? Because most of us who've grown up in these homes, sometimes we focus on the negative stuff. A lot easier, taking this stuff away, punishing them. How do we move from that? Because these kids have been traumatized. They've had a lot of loss. And when we take more stuff away from them, sometimes it doesn't matter. And sometimes it triggers them and they're re-experiencing their trauma. And now we need to move into relationship. So what I've shifted in is, okay, if I have to really think about punishment, I don't really like that word, but we use it, discipline with a kiddo, because they're struggling, their consequences, they get to hang out more with me. And that means we're gonna do enriching things. Like, I might go to recess with them and I might actually push them on the swing and I might play with them. Or during class, I might be hanging out with them. They might not love that, but that's what they need, right? So one of the examples I give parents who have kids, like foster parents who have kids coming in their home who are having a lot of hard times with eating, I always say, you know, you put a basket out and they can take any of the food that they want. So then they don't ever have to worry about where the food's gonna come from. And in that basket, you only put things you're okay with, and you only put the amount that you're okay with that, right? Like, you don't go to Costco and buy a big old thing of granola bars and dump the whole thing in. It will be gone within minutes, okay? And every time a kiddo has to get something out of that basket because they're hungry, then they have to come sit next to me and eat it. Because that is a connection, right? So I want you to really be thinking about how can you bring into classroom, your classroom management strategies, how are you connecting with them? So maybe you do want to take that recess away for some reason. Why do you want to take it away, A? How is that benefiting the child, B? And C, maybe it's not about taking the recess away, maybe it's about putting somebody out at recess that can have a relationally enriched experience with that kid. Or maybe when they're in at recess, it's about playing a game together. It's about one-on-one time. And it's not about them just getting their homework done, right? So be shifting those things. Detention, how many of us have detention in our schools? How effective is detention? I mean, for real, right? And now some of them can have their phones, and they're like texting each other like, this is ridiculous, I can't believe I'm here, I gotta do 10 more minutes. What a great opportunity though. If we actually had detention that was relationally enriched, that would shift things completely. Where they have to come in and they have to engage with each other, they have to engage with the person who's running detention, maybe they have to do some sort of teamwork, creation. I'm not completely against the whole labor thing. I'm not completely against that. Because I think that when it's done in the right way, you can have a sense of pride in what you've created and what you've completed.
Building character.
It does, it builds character, right?
And calluses.
And calluses. I kind of have this dream that someday I'm gonna write a book called Work Ethic and Financial Smarts, something along that lines. Because I think if you can get through life with a really good work ethic and understanding money, you're probably gonna be okay. And so I'm not totally against that. But I mean, think of how you can shift that in your school. If you make these consequences more relationally enriched, then we're addressing trauma. Then we're allowing trauma to start, the kids who have that to start healing. But if we isolate them, what kind of message are we sending them? We're sending one more message: you're not wanted. You're not wanted. I don't care about you. I don't love you. And like it or not, whether we want to say the words or not, every kid who sits in our school, in our settings, they want to be loved. And they want to be loved by you. Now, we might not use that language, but our actions talk about that. Right? So we need to send those actions. Yes, I do love you. Yes, I do care for you. Sadly, my teacher's gotten a few notes from me that have said, I am so sorry we didn't get homework completed. We instead connected tonight as a family. And I don't feel too bad about that. And she's kind of understands where I'm at this point. So, you know, because there's just some days that are really stressful. Having a kid be able to say, you know what, I can't do this right now. my stress response system is activated and I'm not present to do that. What an empowering thing when we listen to that and we let people hear that. We hear what they're saying, we let them say that to us. Okay, we've talked a little bit about what's been modeled for us, what's been taught. We talked about the walking. People learn how to walk because we all look the same. But emotional expression is a lot different. Right? How many of you, by show of hands, teach kids how to listen to their bodies? This is not a typical thing that we do. So the question is, what is your body telling you you need? Right? Do you need food? Do you need a drink of water? Do you need to get up and walk? Do you need a break? What do you need? And when we teach kids that, how many of us as adults listen to what our bodies need? Show of hands, anyone? Anyone? How many of us push past the point of what our bodies need? I love naps. Naps might be one of my favorite things in the whole world. Rarely do I take them. And I always say, God, I should have taken a nap. I would have felt better, right? We even have research about how naps make us feel better. And I feel guilty if I take a nap in the middle of the day. But that's what my body might need. Okay? All right, so that leads into self-care. Since everyone here is doing such a fabulous job of listening to your bodies and what you need. All right, one column, I want you to write 5 things that you know you love to do. Know you love to do. You know you love to do it. You've gone into the mouth. The flesh knows you love to do that. All right, how many of you had something on your list that you do daily? Awesome. Okay. How many of you had more than 2 things? Had 2 things that you do daily? 3 things? 4 things? 5 things? Impressive. I want your list. All right. So what's the point of that? We have to do things that make us feel okay. We have to do things that take care of ourselves, right? Okay. Look at your neighbor. Write down in writing your commitment to yourself of what you're going to do in the next week to take care of yourself. I am going to run. I am going to laugh. I am going to, whatever it is that you know you're going to do in the next week, I want you to write down, and your person next to you gets to sign it, and you're going to sign it. You've now entered into a contract. All right, did everybody sign a contract? How many people actually followed through on that? How many people actually followed through on signing a contract? Thank you for being compliant. I'm taking note of who's doing this. All right. That's all the time I'm going to spend on self-care. I believe that it's probably one of the most important things that we do. And I also think that we need to teach other people how to do it. And we need to teach kids how to do that. Right? And so if you grow up in a home where people aren't good at self-care. So if I'm a little guy and I've seen my parents use drugs and alcohol their whole life, and I don't know what healthy means, I need people who will teach me what healthy means. I need people who will tell me that I need good nutrition, that I need to get exercise, right? That's one of my qualms with the whole recess thing, is that a lot of these kids don't even know about exercise, and then we take that piece away, right? Or they don't have opportunities to take care of their body at home. So it's our job to be modeling for them and sharing that with them, right? So, and it's also good to say, wow, I need a brain break. Everybody up. Oh, Stacy, we hate brain breaks. I saw it. Did you feel it? Like people are like, oh. That's because you all are living in your cortex. That's why this is hard for you. But you are educating people who don't have cortex. So you need to meet them where they're at, okay? So we're going to spin around 3 times slowly so you don't need to recall. Alright? Then we're going to take our right hand, and we're going to touch our left foot. Oh, yeah. We're going to take our left hand, and we're going to touch our right foot. If we can't do that, we're going to look at our occupational therapist. And we're going to make an appointment, and we're going to do that 5 times. And you can complain at me later. like